This slide should look very familiar to you in that what risk factors can we change that are modifiable, what are some that we cannot change. So if you're looking at risk factors for disease, obviously the column on the left, these are the things you can't change. You can't change your age, your gender, your race, or your genetics. Your environment, that is a little tricky. Some of this can be changeable, but it can be challenging to change it as well. Changing socioeconomic status, that can be a real factor for people. Where you live, do you live in an area that has high pollution? Do you have high traffic? So your environment may or may not be changeable. And then behavioral risk factors, you're probably very familiar with these through Health 300, through some of the classes that you maybe have had with Dr. K. You know, behavioral risk factors are things we can control. So a lot of people think the susceptibility or the genetics is the big influence, but that's not necessarily the case. And if you look at, for example, the influence on atherosclerosis alone, you know, your genetics is sort of this overarching component, but it's really the risk factors in the lifestyle that causes those genes to actually be turned on to increase someone's risk for disease. So genetics isn't everything. There's a lot to do with lifestyle, and if you look at so many of the things that are listed on this slide, they're also including the environment. What is your access to food? Is it healthy? Is it unhealthy? Do you live in an area that's walkable? Do you have bike trails? You know, what is your physical activity? How do these influence your weight, and how do your weight and your physical activity influence all of these other things that we've talked about so far, such as your lipids and your diabetes and atherosclerosis? And of course, if you look at leading and actual causes of death, yes, I mean, I think we've all covered for many of our classes, you know, heart disease is still the #1 cause of death. Cancer is very close, #2, closing in, probably in the next, 10 years or so. But a lot of these diseases, if you look at the right side of the column, are really behavioral in nature. And of course, we talked so much the other day in class about the role of tobacco smoke, just getting people to cease using tobacco is going to have a big influence, getting people to be a little bit more active, a little bit better diet, increase fruits and vegetables. But look at the other issues as well. Alcohol consumption is definitely going to contribute to unintentional injuries, as well as motor vehicles and firearms. And do you live near toxic agents? It can influence lung disease, as we talked about the other day. Infection, so due to resistance of antibiotics. So many actual causes of death are behavioral in nature, and many of these are under our control. You're probably also familiar with Healthy People, again through Health 300 and classes with Dr. K. And so these are the overarching goals of what we're trying to do and to get people to live longer and to live better. Health equity, eliminate health disparities. And so that's where one population is going to be disproportionately affected by a certain chronic disease than others. And we've got many examples of that where, African Americans may have more examples of, more incidences of things like breast cancer, and they may have more fatal types of breast cancer. And so looking at disparities in who gets disease and then creating a social and physical environment that's going to help everybody improve health. So, we want people to live longer and to live better. And so the 12 topic areas in Healthy People 2020, you can see nutrition, physical activity, and obesity is just one of the components. So there's a lot involved in Healthy People in making a healthy U.S. other than just nutrition, physical activity, and obesity that we tend to focus on. So many of these other things you may focus on in Health 300, Health 501, substance abuse education, a lot of classes with Dr. Hamill, so a lot of our health-related classes. But access to health care is very important. Getting those preventive screenings and where you live, and mental health is a big factor with that too.